There is a seed, one specific seed, and if you are over 60 and waking up every night with burning feet, shooting pain in your toes, or that constant tingling that never seems to stop, you need to hear what I'm about to say, because this seed isn't a miracle. It isn't magic. But the reason it works, the real reason, is something almost no one is talking about. And by the end of this video, you are going to understand exactly what is happening inside your nerves and why that one small seed is only one piece of a much larger picture you've been missing. I've worked with patients over 60 for decades, and I want to be honest with you right from the start. When my patients first tell me they've been rubbing things on their feet or eating this seed every night or trying this trick they found online, I don't dismiss them, because here's what I've learned. They're usually onto something real. The problem is they're only getting a fraction of the benefit. And the reason why tells you almost everything you need to know about what's actually going wrong in your nervous system. That seed, whether it's flaxseed, hemp seed, or the one you've been reading about, typically contains compounds that interact with the inflammatory pathways around your peripheral nerves. Omega fatty acids, lignans, natural compounds that have a measurable effect on nerve inflammation. So yes, there's a real mechanism there, but here's what nobody is telling you. The relief you feel is partial, temporary, because the real damage, the structural damage to the nerves themselves, is still progressing. And that's what we need to talk about right now. Let me describe something to you, and I want you to tell me if this sounds familiar. You go to bed, the house is quiet, and just as you're starting to drift off, it starts. A burning sensation in the soles of your feet, not discomfort, burning, like someone pressed a hot iron against your skin from the inside. You kick off the blanket because even the weight of the sheet feels like pressure on an open wound. You sit up, you try to rub your feet. Sometimes that helps a little, sometimes it does nothing. And you lie there in the dark, exhausted, in pain, wondering if this is just what the rest of your life looks like. In the morning, the burning is still there, or it's shifted into something else. A deep numbness in your toes, a tingling that moves up your foot toward your ankle. You stand up and there's that half second where you're not sure how solid the floor feels under you. You've started holding the wall when you walk to the bathroom. You've stopped wearing shoes that require bending over to tie. Small things. Things you don't talk about because you don't want to worry your family. But things that are getting worse, not better, month by month. Quietly, relentlessly. I've had patients cry in my office, not from the pain, but from the frustration. They went to their doctor. They described exactly what I just described to you. And do you know what they were told? That's just part of aging. Or they were handed a prescription for gabapentin or Lyrica and sent home. And I want you to understand something. Those medications, I've watched what they do to patients over 60. The dizziness, the mental fog. Patients who can no longer remember the names of their grandchildren because they're walking around in a pharmaceutical haze. And the nerve damage? Still progressing. The medication masks the signal while the structure deteriorates beneath it. This is not your fault. Nobody told you what was actually happening. And here is the part I need you to stay with me for, because this is where everything changes. If what I'm sharing today is new to you, and I suspect it is, make sure you subscribe to this channel. I release critical health information for people over 60 every week. Information your doctor may not have time to share in a routine appointment. Hit the subscribe button below. It costs nothing, and it could be one of the most important health decisions you make today. Now, let's talk about what's actually happening to your nerves. Think of your nerve fibers as electrical cables running throughout your entire body, from your spine all the way down to your toes. Every one of those cables is wrapped in a protective coating called myelin. It works exactly like the rubber insulation on a wire. When the insulation is intact, the electrical signal travels cleanly and quickly. You feel sensation normally, you have balance, you have coordination. But when that myelin coating starts to break down, the signal gets distorted, fragmented, it leaks, and you experience that leakage as burning, as tingling, as shocking pain, as numbness, depending on which fibers are affected and how severely. Here's what the research increasingly suggests about why this happens, and why it's happening to so many people over 60 specifically. There are several converging factors, and this is where it gets really important. First, vitamin B12. The methylated form, methylcobalamin, is the single most critical nutrient for myelin production and maintenance. Your body cannot make or repair that protective coating without it. And here's what nobody tells you. After the age of 60, your stomach's ability to absorb B12 from food and from most supplements drops dramatically. The cells in your stomach lining that produce something called intrinsic factor, the protein that binds B12 and allows it to be absorbed, those cells become less efficient with age. And if you are taking metformin for blood sugar, I need you to hear this clearly. Metformin actively blocks B12 absorption. It depletes your levels month after month, silently, and the standard blood test your doctor orders doesn't even catch early-stage deficiency. The result is that millions of people over 60 are walking around with critically low B12 levels, their myelin breaking down, their nerves deteriorating, and no one has connected the dots. Second layer, oxidative stress. Your nerve cells contain structures called mitochondria, the energy generators inside every cell. Over decades, these structures accumulate damage from what we call free radicals, unstable molecules that attack cellular tissue. Your nerves, because they are among the longest and most metabolically active cells in your body, are especially vulnerable to this kind of damage. And here's what makes it worse. The antioxidants that can reach inside nerve cell mitochondria, specifically alpha-lipoic acid, decline naturally with age. So the protective mechanism is weakening at exactly the same time the damage is accelerating. That is not a coincidence. That is a biological convergence that the research has been pointing to for years, and that conventional medicine has largely ignored. Third layer, and this is the one that surprises my patients most: chronic low-grade inflammation, not the kind of inflammation you feel after an injury, invisible inflammation, systemic. It flows through your body every day, quietly attacking nerve tissue, disrupting the blood supply to peripheral nerves, and accelerating the myelin breakdown I described. What drives this inflammation? Blood sugar dysregulation, even mild subclinical levels that don't qualify for a diabetes diagnosis. Even prediabetes creates enough glucose-related damage to the tiny capillaries that feed your peripheral nerves that over years, the nerves literally start starving. That's why the research is so clear that this problem affects not just diabetics, but anyone with blood sugar that trends high. Researchers at major university medical centers have published findings on the role of B12 deficiency and oxidative stress in peripheral nerve degeneration. Findings that, frankly, most practicing physicians have never had time to read. Their conclusions point consistently in the same direction. The peripheral nervous system, when given the right nutritional environment, has a remarkable capacity to begin recovering, not overnight, but meaningfully, measurably over time. The studies on methylcobalamin supplementation specifically show improvements in nerve conduction velocity, the speed at which signals travel along the nerve, in patients who maintained adequate levels consistently. I want to tell you about a patient I'll call Harold, 71 years old, type 2 diabetic for 12 years, came to me after 2 years on gabapentin that had him so foggy he'd given up driving. The burning in his feet was bad enough that he'd started sleeping with his feet hanging off the side of the bed because he couldn't stand anything touching them. He'd been told the neuropathy was permanent, irreversible. He'd accepted it. When I ran a full panel on Harold, his methylcobalamin levels were severely depleted, almost certainly exacerbated by the metformin he'd been taking for a decade. His alpha-lipoic acid was essentially non-existent. We worked together to address those deficiencies using specific, bioavailable forms of the compounds the research supported. 6 weeks later, Harold called my office and said he had slept through the night for the first time in 2 years. That's not magic. That's giving depleted nerve tissue what it needs to begin functioning again. Because this is what I need you to understand, and why what I'm sharing today goes so far beyond any single seed or any single remedy. The emotional weight of this condition is something that doesn't show up in a blood test. I've sat with patients who have stopped going to their grandchildren's birthday parties because they're afraid of falling, who have moved out of their homes they raised families in, because they can no longer navigate the stairs safely, who don't tell their children how bad the pain is because they don't want to become a burden, who feel a kind of grief for the person they were 2 years ago before all of this started. That grief is real, and it deserves a real response, not a pill that dulls the pain while the damage continues, not a doctor visit where you leave with less information than you arrived with. A real science-based understanding of what is happening and what you can do about it. The link in the description below takes you directly to the natural nerve support formula I recommend to my patients. It combines everything I've covered today in the specific forms that actually reach nerve tissue. Take a look when you have a moment. I think it will make a lot of sense after what you just learned. So let me walk you through the compounds that the research supports most strongly. Methylcobalamin, not cyanocobalamin, not the synthetic form you find in most cheap supplements that your body can barely use. Methylcobalamin is the bioactive form that crosses directly into nerve tissue. It is essential for myelin synthesis, and the research on its role in nerve regeneration is as solid as anything I've seen in my career. Next, alpha lipoic acid. This is a fat and water-soluble antioxidant, meaning it can penetrate cell membranes that most antioxidants cannot reach. It works specifically inside the mitochondria of nerve cells, neutralizing the oxidative damage that has been accumulating for years. Studied extensively in clinical settings specifically for peripheral nerve support. Third, benfotiamine, the fat-soluble form of vitamin B1. Standard thiamine is water-soluble and doesn't penetrate nerve tissue effectively. Benfotiamine does. It has been studied in European clinical settings for decades for its role in protecting nerves from glucose-related damage, which, as I described, is one of the primary drivers of this condition in people over 60. Fourth, acetyl L-carnitine, an amino acid compound that supports energy production inside nerve cells, giving damaged nerve tissue the metabolic fuel it needs to begin the repair process. And fifth, magnesium, which regulates the calcium channels in nerve cell membranes. When magnesium is deficient, and the majority of people over 60 are chronically deficient, those channels become hyperexcitable. That hyperexcitability is directly linked to the shooting pains, the cramps, the electric shock sensations that wake you at night. Now, finding each of these in the right forms, the right doses, and the right combinations on your own is genuinely difficult. Most people over 60 don't have the time, the access, or the knowledge to build this protocol from scratch. That's why I've left a link in the description to a formula that brings all of this together. I've reviewed it carefully, and it's one of the few options I feel comfortable recommending to my patients. Let me tell you why your doctor hasn't had this conversation with you. It isn't because they don't care. It's because the medical system is built around pharmaceutical interventions that can be patented, standardized, and reimbursed by insurance. A 10-minute appointment, which is the average length of a primary care visit in this country, is not enough time to explain mitochondrial oxidative stress and myelin degeneration to a 67-year-old patient. So physicians prescribe what the system supports. And the system supports gabapentin, not methylcobalamin. This isn't a conspiracy. It's a structural problem, and the result is that millions of people over 60 are suffering from something that the research clearly shows is at least partially addressable, and no one is telling them. You are not powerless here. Your body has a capacity to respond when given the right support. The peripheral nervous system is not a static structure. It is dynamic, living, and the research suggests that when the specific deficiencies driving this damage are addressed consistently with the right bioavailable compounds, real improvement is possible. And the next time you reach for that seed or whatever has been giving you some temporary relief, I want you to remember what I shared today, because now you understand what's actually happening inside those nerve fibers and what is actually possible when you go deeper than the surface. If today's video opened your eyes to something important, share it with someone you care about. Because there are millions of people over 60 dealing with this silently, and they don't have to. The link in the description goes directly to the natural formula I recommend. Take a look when you have a quiet moment. Subscribe for more critical health information every week. And leave a comment below. What was the most surprising thing you learned today? I read every single one.